Hello, everyone, and welcome to today's webinar. I'm Steve Myers, Managing Editor here at Digital Health Insights, and we welcome you to today's presentation, Managing Patient Relationships in 2024, where the EHR falls short. We're bringing this content to you in conjunction with TeleVox, and today's presentation will feature a typical presentation followed by some Q&A. So a few quick notes before we get started on that. You'll see a Q&A function. Feel free at any time to submit a question, and we will gather those up and get to as many questions as we can. At the end of the presentation, we should have a decent amount of time, so keep those questions coming in. Also, this presentation, this entire webinar will be available to you on demand shortly after it closes today. We will send you out an email alerting you to the fact that the on-demand version is available. And if for anybody who has not signed up, if you tell somebody, tell your friends how great the webinar was, they can still sign up and access this on demand. So let's get into today's presentation on managing patient relationships and where the EHR falls short. I'm going to hand things over to our presenters today, Vijay Verma, who's VP of Product at TeleVox, and Donna Robinson, Chief Commercial Officer at TeleVox.
Thank you for joining us today as we discuss managing patient relationships in 2024. As we look at patient relationship management, or the PRM, we're going to work to define it for you. We will also delineate where the EHR falls short and the impact of care and quality initiatives as a result of not using a patient relationship management system in conjunction with an EHR throughout the care journey. Hi there, I'm Donna Robinson, and I'm the Chief Commercial Officer for TeleVox. I've spent the last 25 years in healthcare IT, most recently at Change Healthcare, now Optum. And there I was focused on revenue cycle management technology and leading teams focused on that, as well as imaging solutions and patient engagement. Prior to that, I spent 15 years at a company called Spoke, where we were focused on clinical care team coordination and critical communications. And I'm joined by my colleague, Vijay Verma.
Hi, I'm Vijay Verma. I'm Vice President of Product Management for TeleVox. My team leads design and delivery of our enterprise product portfolio. Prior to TeleVox, I was Associate CIO for Children's Hospital of Philadelphia, where I led the emerging tech and transformation teams. And before that, I have a long history of working with healthcare organizations, and I'm excited to be here to provide my point of view. So patient relationship management is a new concept, new terminology. After this presentation, we want you to walk away with a clear definition of what patient relationship management is, understand how it is different than what's currently practiced today in our industry, and how is that costing all of us. And finally, in spite of all the time and resources committed to our EHR implementations, why EHR cannot evolve to be the patient relationship management solution.
First, we're going to define patient relationship management and the value it brings for the patient and the healthcare ecosystem. So patient relationship management, or PRM, as we'll note it throughout the presentation, those solutions foster long-term, personalized relationships with patients. And they do that through sustained and meaningful bidirectional communications. Principally, patient relationship management is about building a continuous dialogue between patients and their caregivers, where both parties feel like equal stakeholders in the conversation and the care plans. This is different than feeling like you're participating in a transaction, which is one-way static communication. Patient relationship management is a conversation that happens in an omni-channel way, meeting patients where they are on their preferred device or their preferred mode of communications. And this is a paradigm shift that's important, considering the cost of providing care has been increasing unsustainably, leading to the rise in value-based care models. Unlike episodic patient engagement, Patient relationship management emphasizes that continuous data-driven interaction, enhancing the patient experiences and outcomes while offering significant operational and financial benefits to health systems and to providers.
This is very different than the current engagement models in our healthcare. There is no shortage of outreaches from various staff members to the patients. Some require the patient to verify their demographics for the umpteenth time, or update their insurance, or to follow up with results from a recent result. These outreaches are made via phone calls, patient portal messages, text messages, and many other channels. Your staff probably feels overwhelmed by the number of scenarios for which they have to contact the patient. There is a strong likelihood that you can't reliably answer which staff members have contacted the patient in the last 30 days. Even deeper questions are, how many different modalities were leveraged to communicate with the patient? How effective were these outreaches? And how many of these outreaches factored in patients' preferences as opposed to your institution's convenience? Cumbersome, convoluted, and complicated that this landscape is, this is only one half of the puzzle. Patients likely feel that they're not contacted enough, or they are only contacted for topics that are convenient to the care institution. When patients have questions of their own, their attempts to get information get lost in long hold times or a standard reply that this message may take 3 to 5 business days to respond. So what does an alternative look like? At the highest level, there are 4 main categories of experiences at play within a care institution for patient care. We have call centers for making voice outreaches to patients and for answering incoming calls. We have the EHR for the clinical interactions. We have adjacent services like labs and pharmacies. And then we have traditional marketing functions like web and email-based interactions. These 4 don't necessarily talk to each other and don't necessarily present a cohesive experience to your patients. Patient relationship management encourages us to bring the patient to the table and even think more from their perspective. They are, after all, not only the paying customer, but also the one whose health outcomes are most at stake. PRM proposes an ecosystem that brings together a unified experience that a single system cannot enable. We are talking about bringing structure and value to these 4 pillars of conversations and interactions that happen with patients, whether it is clinical care, call center, marketing, or ancillary services like labs and prescriptions. These should feel like a single experience to the patient rather than a disjointed experience where one side doesn't know what's going on with the other.
Why are we here to talk to you about patient relationship management and that mindset? TeleVox has been leading thought leadership for patient relationship management for a long time. In fact, we had a big part in creating this space through many, many years of being the trusted advisor for health systems. Our customers or our partners are constantly working with us on new use cases that improve care and quality outcomes and empower the patient to actively participate in the conversation about their care. We've had the pleasure of partnering with many health systems and organizations that this journey started over 31 years ago for us. We have deployed our platform with thousands of use cases across the entire patient care journey. We have experience at scale with a library of outcome-based use cases, and we serve over 7,000 organizations today of various sizes. We work with large IDNs, academic medical centers, community hospitals, health systems, as well as private physician practices. As Vijay mentioned earlier, he was previously the head of emerging tech at a transformation at a top tier academic medical center. And prior to that, he was the head of customer experience and engagement for Comcast, where he'd led design and technology.
Honestly, some of my first wins at Comcast were purely accidental. we were looking to solve a problem of how to reach more customers effectively. And we ended up creating a brand new self-service channel and started noticing that customer engagement patterns were changing for the better. And all of this happened without any additional customer or staff training. This was around 2017. So in some ways, I've been at it for a long time. I've been working on providing omni-channel solutions through different verticals. With TeleVox, we finally have this opportunity to build this upgraded level of patient relationship experience within healthcare. So now that we've defined what patient relationship management is, and to recap, it's principally around providing a longitudinal and inherently bidirectional communication framework. Let's look at some of the data points that show the unmet need in the current setup. So we make no assumptions that care journeys are same or they even work the same way for different patients. But for sake of our conversation, let's take a simplified look at an entire care cycle. There is a phase which involves patient discovering what kind of care they need, either on their own or in consultation with their primary care physician. This is followed by a patient going to the actual visit. This could be virtual or this could be in person. It could be ambulatory or inpatient. It could be urgent care or an ER. And finally, we have patient needing to continue care after the actual appointment is done.
So why is this important? 77% of patients say they will delay or avoid medical care due to lack of engagement from their provider. Patient relationship management systems simplify the patient experience and create positive, continuous conversations between the patient and provider, which helps them improve the relationship and encourages the patient to take action and along every step of the way. Patients are 2 times as likely to follow up on treatment plans if they are engaged with their provider. And PRM systems improve compliance by ensuring that patients are invested in following their care plan. Patients who engage with providers have a 5 to 10% lower hospitalization rate. And patient relationship management solutions support this engagement at every step through automation. I'm going to highlight an example of why this is important in practical terms. My friend recently had an experience that shows why this is so important. He visited his PCP recently, who's not employed by a hospital system, so a true private practice. The PCP gave him a referral for an X-ray to a large health system. The health system did not contact him, and the PCP had informed him that they wouldn't, and instead they told him to call the number they provided on the referral slip. Well, the number connected him to the medical imaging scheduling department, who apparently only schedule appointments by receiving the inbound calls from the patients. So he called and he had to wait on hold for a long time, as we all do at times. He's a busy executive, so that was frustrating. And when he actually got on the line, they told him that with his type of X-ray, it was walk-in only, and they don't even schedule set times for that. All of this wasted time and frustration on the patient, from the patient's perspective, could have been completely avoided using a patient relationship management solution and automating all of this process, leaving the patient experience in a much higher place and eliminating all these manual tasks for the scheduling department.
Let's look at the next step of the journey, receiving care. So virtual show of hands. How many of us are fans of lists? We make a list for groceries, maybe chores that need to be done around the house. We definitely make a holiday gift list. For the folks in the audience who are part of the care team, how many times do you see a patient walking in with a list of topics to talk about? Maybe scribbled on a piece of paper or on a well-kept diary. And how many times have you wondered how long was this topic floating around in the patient's mind, and were they at ease with it, or were they relying on Dr. Google for clarification? When the visit gets done, we hand the patient with another list. Here is your after visit summary, printed, maybe in the patient portal as well. Good luck. Feel free to reach us back. Oh, there may be some delays over the phone because the staff is stretched thin, taking care of other patients as well. Or the care coordinator may have left the office and will return tomorrow. And there's a chance that we may actually charge you for the patient portal message. What's the end result? 49% of the patients leave the hospitals with unresolved questions and don't receive a timely follow-up. 50% of the patients reported confusion about the next steps in care after a hospital visit or procedure. And these patients, 30% are less likely to be readmitted if they have a follow-up within the next 7 days of discharge.
These are all areas where a patient relationship management solution can help improve the patient experience, care compliance, and overall better outcomes. And I have a personal story to share here. Over the Thanksgiving holiday, I had an emergency appendectomy. Post-recovery, of course, I was exhausted. The discharge nurse came in and handed me a packet of discharge instructions, which was huge. It was a packet of information that contained much more information than what I needed, as it contained follow-up instructions for many types of surgeries. To be honest, I didn't read it carefully, and I somewhat disregarded it just due to the 30 pages stapled together and the amount of information that was not relevant for me. Of course, when you leave the hospital and you go home, most patients go home and sleep like I did. And by the time I actually focused on the paperwork I was given, I'd already bypassed one of the key instructions that likely led to me ending up back in the ER 2 days later, where I was very close to a sepsis diagnosis. The point here is ensuring that key information is delivered to the patient in their preferred modality of communication, that we keep the conversation alive. That increases compliance and adherence and promotes the best possible outcomes for recovery. And this is all clearly possible when utilizing a PRM solution. Engaged patients are 20% less costly when you look at the care over their lifetime. They're more focused on prevention, and they're actively participating in the conversation about optimal health or managing chronic diseases with ongoing and persistent communications from their provider. Ongoing patient outreach can reduce no-show rates by 20 to 30%, improving the continuous care and timeliness of any changes to care plans that need to be made suddenly. We know when healthcare is designed to focus on quality of care and patient experience, these are the things that individual patients value most.
Let's take a specific look at chronic care and long-term engagement. Imagine you are a patient and your chronic conditions flare up, but your appointment isn't for next couple of weeks, or you've had a surgery and you're unsure of post-op steps. These scenarios highlight the critical gap after the appointment, where a longitudinal patient relationship management really should kick in. Because in both of these scenarios, there is a need to continue care outside the four walls of a traditional practice. For chronic conditions, think about the care team and patients as partners. Long-term relationship leads to better understanding of specific needs and adjustment to treatment plans needed for optimal results. Regular check-ins support, empower patients, and manage their conditions effectively, and these help prevent complications and hospital readmissions. Imagine receiving reminders for medication adherence or tips for managing stress, all tailored to your specific situation. If your doctor knows your baseline and can track subtle changes, then they can catch potential problems early, preventing bigger issues down the line. Think of it catching a fire before it becomes a bigger issue. Similarly, like if you were in a post-procedure recovery journey, that post-surgery support is vital. Timely follow-ups and proactive monitoring can address side effects, answer questions, and ensure proper recovery, reducing the risk of complications and unnecessary readmissions. Think of it having a coach guiding your patients through the recovery process at every step of the way. Efficient post-op monitoring allows for fine-tuning of treatment plans based upon your individual responses. This proactive approach leads to faster and more complete recoveries, maximizing the benefits of the surgery. Feeling cared for and being supported throughout the patient journey from pre-op to recovery fosters trust and a sense of relationship with your care team, leading to more positive overall experiences. Principally, remember, longitudinal care is not about extra doctor visits. It's about building a bridge between the appointments, creating a safety net to catch potential problems, and proactively working towards optimal outcomes. It's about having a team cheering the patient on every step of the way, whether they are managing a chronic condition or recovering from a procedure, and doing all of this without putting more operational burden on your already stretched staff. In some ways, none of this is new. Your staff is likely calling to check in on patients. After all, various published studies have shown the impact of these outreaches on eventual outcomes. What PRM enables us to do it at scale in an automated manner that saves your staff important time and your patients an adverse outcome. So why did we end up, where we have these big gaps between discovering care and receiving care and then continuing care? There are two main engagement patterns that have been at play within our industry. First, that this is a patient engagement issue. If only we get more patients to confirm or cancel their appointment, we will have less no-shows. Let's send an email or a text blast to a well-identified pool of patients who need a recommended care gap. These are just two examples of outreaches that are driven by the care institution. These are, however, point in time and ephemeral. They reach the patients and they dissolve, like Ethan Hunt's assignment in Mission Impossible. If the patient attempts to reply to the text later on, that channel is usually a dead end. The second problem at hand is delegating the EHR to deal with it. EHR will adequately send a notification for an upcoming appointment or that lab results when they are available or when a bill has been posted. These tend to work for some patient in your pool and in the context of some encounters, but they don't necessarily work for all different scenarios. Let's specifically compare how patient engagement is different than patient relationship management. Patient engagement solutions are focused on providing point solutions in a patient journey. This is a good reason why we have no shortage of digital health solutions deployed in institutions at any given point of time. Because of their narrow focus, these end up being very good at pilots and rarely go to an enterprise scale and rarely scale to be a comprehensive patient journey. Most of the digital health vendors have been guilty of being point solutions. There are vendors that are very good at fixing specific pain points in the patient journey, and unfortunately, they stop there. There are solutions that propose to make finding providers easy. There are solutions that will help you book appointments. There are solutions that send reminders for these visits. And you and your patients end up needing to know which solution to use and when, which is what results in a fragmented experience because of these isolated patient engagement solutions. Patient relationship management is a single pane to manage your patient's needs. It removes the friction and fragmentation, which would otherwise impede the desired outcome for you or your patients. It knows which patients need what information and via what modality. The difference is not only meeting the current needs, but also anticipating what would be next and how to enable the transition. A very specific example would be to allow you to provide voice and chat-based outreaches and for any outbound and inbound interactions for with every single call to action, wherever appropriate, prioritizing the patient's preference for do they prefer chat or do they prefer voice? Do they prefer email or do they prefer or an SMS outreach? The other side of the comparison is comparing this to EHR-driven engagement. There are so many millions of dollars annually being spent on the EHR transactions. So there is that, and you also have like a large number of analysts working on different clinical workflows. So why don't we just simply turn on a new feature in the current EHR and let's look at how well that works. So that is a common trap that we see in different institutions. The odds are very high that you spend a significant time and effort in getting every patient activated on your patient portal, and yet majority of your patients don't actually use the patient portal before their appointment. And this number could be as high as 70%. There are a few main reasons why this happens. First, patient portals tend to work for existing patients. They don't work for new and prospective patients very well. Second, EHRs are very geared for the care team's clinical workflows. And finally, patient portal is one of the many mobile apps or bookmark website on your patient's devices. If the patient feels the current patient portal meets your institution's needs more than it meets their needs, they're not likely to treat this as a trusted partner in the journey. They will use it, but they won't love it. And that's a big difference in adoption. Patient relationship management changes this by being there every step of the way, whatever the patient needs, whenever the patient needs it. It's there to provide them a consistent, frictionless experience and that bidirectional connectivity, which is needed to build a relationship.
So what does all of this mean? Patient relationship management needs to be addressed at all the stages of the patient journey. Increasing communication throughout the patient journey dramatically improves patient experience and improves quality measures in patient care. The PRM helps to support patient-centered care goals with better outcomes and better overall experiences. Customer experience leaders in healthcare have seen satisfaction scores go up by 60 to 80% higher than industry laggards when patients have a high level of engagement regarding their appointments, their care plan, through the follow-up stages. And providers with the strongest patient relationships have a net promoter score of 2 times higher in general than others. And these objectives can drive patient retention as well as improve overall patient-provider relationship and provider reputation management.
To recap, a good patient relationship management experience is a longitudinal experience that works for multiple stages of the patient journey. It is inherently bidirectional that supports the institutional's care needs and operational needs, but also prioritizes the patient experiences and the patient preferences via an omni-channel experience that is purposefully built not to exclude any single patient and any single need.
Next, we're going to talk about why the EHR can't manage patient relationships, and we've touched upon a few examples already. But one fact that we can't dispute is the EHRs are the biggest cost investment that any healthcare institution makes. We've heard about organizations spending over $700 million just to upgrade their EHR systems this year. These are not small investments, and it's understandable why the EHR companies get so much attention from healthcare institutions. EHRs are very good at being the repository of clinical data for patients. They're also good at care coordination, and that's needed, throughout the time of care. And they're absolutely needed for a variety of different compliance needs. But what we hear from healthcare organizations is clearly that the EHR does not solve all of their problems. If you've heard or felt that there is a digital divide in your patient pool, you're not alone. Almost every health system is dealing with issues involving health equality. In all likelihood, you've spent a significant amount of time and effort trying to get as many patients activated on your patient portal as possible, yet a significant portion still don't actually activate or even use the patient portal at all. We can blame app overload or notification fatigue, but the impact is real. And the biggest theme we hear is the EHR is built to be the system of record, but it's not a system of engagement or action.
There's a common saying that in management circles that what got you here won't get you there. This is unfortunately true about EHRs as well. They are genuinely good at what they do. They are good at digitizing medical records. They're good at tracking who prescribed what and when. They're good at documenting, tracking, who documented what and when. And they're good at creating standardized care pathways in your institutions. While EHRs continue to make advances in being more patient-centric, because of the nature of being anchored towards existing patients and existing visits, they cannot evolve seamlessly to cover patient needs across all 4 categories that we talked about earlier in the deck. This would be akin to expecting existing care models to work in a fully virtual model. We all know how that worked out. We needed a fresh thinking. We needed a different engagement model, and we needed, in some cases, a different care model. This is where we think PRMs will deliver patient-centric workflows that are personalized at multiple levels, extensible via partners, and nimble with much faster time to execution and a much shorter time to evolve for our changing business needs.
Now we're going to look at how TeleVox solves the gaps in patient relationship management. This slide highlights one example of how TeleVox makes relationships stronger. On the left, you have a very simple transactional text message. This is static and not actionable. These are basic notifications with fixed responses that I'm sure you are familiar with in many areas in your consumer experience. On the right, you see a completely different scenario for the patient. With TeleVox Smart SMS platform, the communications with the patient are persistent, they're actionable, and they're conversational. Smart SMS is similar to what the patient is used to in their consumer experience, so it feels much more inclusive for them and intuitive. What we have learned from customers who use our platform, which is completely configurable and customizable, is that with the persistent, actionable, and conversational outreach, patients are more satisfied. They describe their relationships with their providers as improved. And they're completing more appointments. They're participating more in their care plans. And behind the scenes, the health system is automating these manual tasks, allowing their staff to focus on other important responsibilities.
While Smart SMS is one of the value propositions that TeleVox brings to the patient relationship scenario, our overall portfolio is even more comprehensive and covers the sweet spots that we talked about. Most of you have seen TeleVox's overall product portfolio. To recap, we offer products in 4 categories. Digital front door, which aims to simplify patient-initiated outreaches. Appointment management that aims to have patients be better prepared for their appointments and reduce last-minute surprises. Digital care programs for better care outside the 4 walls of an institution. And patient marketing, which along with digital front door aims to build for more revenue by attracting and retaining new as well as existing patients. If we cross-reference this portfolio with the simplified patient journey that we introduced earlier, you will see how TeleVox positions its products to confirm that patient needs are met at every stage of the patient care journey. TeleVox is not a point solution. We are not a company that just does reminders or just does a virtual agent or just has a chat solution. We have proven outcomes that show how an integrated patient journey is a win-win situation for your institution as well as your patients. Financial success through patient success is a motto that we live with, and that's why we work in providing a comprehensive product portfolio that meets all of your needs and works for your patients at every step of their patient journey.
TeleVox benefits the health systems, providers, and patients in a few key ways. Our patient relationship management platform is enabling patients to schedule more visits, reschedule their appointments with ease, resulting in less frequent no-shows for providers. Our patient relationship management solution is closing care gaps and reducing revenue leakage. And the PRM empowers the patient to show up prepared for their appointments. From a high level, in all areas of procedure or surgery prep, we save health systems millions of dollars annually by helping patients show up prepared. And this is all done through automation. Whether it's reminders on prep, which are as simple as things like NPO after midnight, or which medications not to take prior to your surgery. For example, a diabetic patient who needs to stop taking their GLP-1 medications prior to surgery, or even a more complex automated colonoscopy prep cadence, reminding the patient from 4 days prior to their procedure what not to eat, and detailed instructions up into the morning of their procedure, organized in a cadence that can be received easily by the patient. All of these communications drive productivity improvements, increased patient satisfaction, and increased revenue opportunities. These types of communications also reduce staff burden, freeing them up to focus on other things. We know that delighted patients will result in patient retention, and our platform enables patients to be better informed and participate in their care journey. This result is more loyalty to their provider with a higher affinity to stay with them for long-term through their healthcare needs.
So in conclusion, first of all, thanks for listening to this webinar. It's been a pleasure. So to recap what we've covered around what is patient relationship management? It's a patient-centric view at looking at how the patient care journey should be orchestrated. It is a longitudinal view at the entire end-to-end spectrum of identifying patients have different needs, which require them to discover care at their own pace or in partnership with the primary care team, and understanding the fact that they have their set of questions and the things that are most important to them around their care journey. PRM should factor into account the priorities of an institution, but it also needs to give an equal weightage to the patient perspective in their care journey, because they are the one who needs that empathetic, warm hand to confirm that they get the clinical outcomes or the care outcomes that are needed for their recovery. So to recap, it's around patient-centric look at the entire care journey with the emphasis on longitudinal relationship and not point solutions that only do handle part of the interaction. And it is essentially a personalization at scale that is powered through data, but leverages the right modalities and the right experiences to bring all of this comprehensively together. It is very different than the EHR engagement by being that connected and continuous workflow. EHR engagement models, they work for specific existing patients in the context of an existing appointment, but they don't necessarily scale for new patients or new needs that are arriving from your existing patients, without a friction, without introducing a friction or having multiple other vendors in the mix. And it is PHR experience is purposefully built to be accessible everywhere, anytime, by any patient. There is no inherent issue of digital divide by continuing to build features in mobile apps or websites that are in a way capped from their engagement point of view, right? You won't see more patient engagement by adding more features in your old antiquated experiences. Where EHR especially falls short is because of its strengths in the past. It was built to be a system of record. It was not meant to be a system of engagement. So that paradigm shift is really, really, truly important, because patients need experiences that work at their pace for needs that they have, in addition to factoring in the care team's needs as well. And we talked about the digital divide, and then also like specifically look at the how do you principally provide a personalized care experience at scale? Right? This is essentially where patient relationship management will truly excel at, as opposed to just providing a standard same experience for that works for every patient, every department, every physician the same way.
This paradigm shift is important, considering the cost of providing care has been increasingly unsustainable and leading to the rise in value-based care models. When you look at how TeleVox can fill in the cracks, we have an AI-powered patient self-service model using our generative AI platform, and we put the tools in the patient's hands to quickly find the information they need. Customized patient communication automations. We have thousands of examples where our customers use our platform to improve patient communications throughout their journey, and all of this using a conversational approach that allows the patient to be part of the conversation. Thank you very much. We encourage you to scan the QR code and find out more information about patient relationship management tools at TeleVox and how these solutions can greatly impact not only improving relationships with patients, but transforming the care journey and positively impacting outcomes for all of us in the healthcare ecosystem. Thank you for your time today, and please feel free to reach out to Vijay or myself if you have any questions, or if we can help you design and implement a PRM solution in your health system. Thank you.
Thank you. Take care.
Okay, thank you. First of all, thank you to Vijay and Donna and TeleVox for such an informative presentation. We're going to get into some Q&A. I will answer one of the popular questions before we get into the meat of them, and that is, yes, this presentation will be available on demand. Shortly after we wrap up today, we will send out an email today or tomorrow letting you know that that is available for you to access. So now let's get into some Q&A, and we have Vijay with us here to field some of the questions that have been submitted. Welcome, Vijay. What emerging trends or technologies that in patient relations management do you see shaping the future of patient care, specifically how PRM can be enhanced using AI and how TeleVox is tapping into that?
Yeah, thanks, Steve. So broadly speaking, the couple of trends that we need to account for. One is omni-channel is necessary, right? You just cannot build a solution that only work in web or mobile. We have to scale where our customers are, whether that is SMS, whether that is voice, whether that is other messaging apps that are in use. And AI allows us to scale to those channels, right? We just don't have capacity to custom build solutions that only work in specific channels and then have to rinse and repeat our business logic or considerations in each of these channels individually. Use of AI, and I would say like more broadly automation and even more broadly technology in general, allows us to reach where customers are and have the conversations and interactions which account for the context of the channel in which the interaction is happening. So I'm generally very bullish on those three concepts: omni-channel, use of AI, specifically automation, and then generative AI to reach more patients and reach more channels.
Okay, very good. Thank you. Can you provide a little more information about how you interface with various EHRs?
Yeah, absolutely. From our product portfolio point of view, we integrate with out of the box. We integrate with all prominent EMRs, whether that is through APIs or through standard formats like HL7 or FHIR. And each one of this instance stays local to the institution that we are serving. And this is a library that we are constantly like building and refining, going on from like, let's say, appointment related use cases to lab results or potentially to self-services related to account access. So that's a library that we come to the table with that integrations built in.
Okay, very good. Another question for you, does this require replacement of existing solutions?
So great question. So there are a few foundational vendors that will obviously stay in the mix. EMR does not really go away. The EMR of choice stays. We don't compete with the EMRs per se, but one of the challenges that we keep hearing from a lot of CIOs and executives is that they have too many point solutions in the mix. So that is kind of like where we will come to the point of, we will come to the table with a portfolio which can consolidate multiple point solutions into one holistic enterprise experience that scales to different needs that you have in an institution. But primarily, we don't compete with the EMR level scenario. We won't compete with Workday, ServiceNow. They all have enterprise needs, but it's the point solutions that have cropped up in healthcare, which is where we can come in.
Thank you for that answer. And on to the next. Is there a recommended starting point for something like this? And are there best practices for healthcare organizations that if there's certain things they should do to prepare for this PRM transformation?
Yeah, great question. So once again, like we are not a monolithic solution. You don't have to take our entire product folio and then deploy it in one big rollout that's going to take 3 years to implement. We are quite flexible in terms of addressing your current needs and then have it grow from there. Some of our customers have, for example, used virtual agent and chat combination. Some of our customers have started from slightly different approach, which is more, can we streamline automated outreaches to our patients, whether that is care gaps or referral closures, and then you go towards other functions like appointment management and chronic care. And other hospital systems have started with chronic care or readmission as a management. Right, so we are quite flexible in terms of how you can start. Our goal is at the end of the day, we present your patients with a holistic single pane of experience that is omni-channel, conversational, persistent. But the starting point is something that is flexible, and we can work with you in terms of your pressing needs as opposed to our specific recommendation starting point.
Can you reiterate or provide some more detail about the metrics that you can use to measure the success of a solution like this for improving patient relationships?
Yeah, another great question, and I think we should look for inspiration to solutions outside of healthcare. So leading brands like Uber, Airbnb, like they all track based upon customer satisfaction. Like how satisfied are your customers? That's kind of like a leading metric, and then subsequent metrics around what is the return rate? How many of your patients actually come back to the same channel for closure? Did they get their answer the first time around? Did it improve your staff productivity as well? So all of these, like some of the metrics that we use to factor in and even like plan how well is our product portfolio working, and then help you benchmark in terms of like maybe these best practices will help us nudge that move needle even further along. But we do come to it as a customer experience and customer being patient as well as the employee. Both of these experiences are important, and we measure our products and portfolio success using these metrics.
So very good. And when we talk about engagement and interaction with patients and patients' data, of course, this question would come up about sort of challenges with this approach to patient relationship management. Are there any specific considerations on the regulatory compliance or even security privacy side?
Well, I think we are thankful that we live in a regulated world, and there are serious rules and regulations around high trust, HIPAA. Like these are the things that we do have to watch out for. Patients' data is precious, and we have to confirm like, that data does not get abused in any shape or form. But we do like all regulatory concerns that either we as a vendor have to comply with, or an institution has to comply with. All of these are factored into our product design and drive and guide what solutions and experiences we roll out.
And does this approach to PRM address the sort of growing need or the trend towards personalized patient care and engagement, communication?
Yes, absolutely. So on the engagement relationship, like that is exactly the the finish line that we are striving towards. What it does not get into, and I want to be cautious of the words, we don't get, this is not about personalized medication. Like this is not about personalized treatment plans or personalized nutrition that is somewhat very clinical in nature. But everything else around confirming that patient feels connected, right? They know where to go for help, and they can go and do it whenever they feel like that connection is clear in the mind, in terms of their questions, their concerns will never be unanswered. Right? That's kind of the model that we've been operating towards.
And I think it's good to close on a excuse me, a forward-looking question. In the realm of patient relationship management and EHRs, what do you see for the future? Are there emerging technologies? We kind of touched on AI earlier, but what's your crystal ball say for this area, for PRM and the EHR?
Great question. There's this data point, some maybe be dated, but like a couple of years ago, like this had come up, that the amount of healthcare data that sits in the EMR is maybe like 5-10% of overall health data that a patient has generated or will be impacted by, right? So we just can't look at a solution set that is so centered on a clinical workflow to necessarily dictate or drive the overall direction of where the patient health is going towards, right? So the crystal ball really is patients will be more in the driving seats. There will be more focus towards preventative care. There will be more focus or even a drive towards personalized recommendation of how you can avoid certain things to begin with. And all that will take connecting patients to reputable and reliable and verifiable sources that can drive all kind of like questions and concerns, that will confirm that the patient actually stays on the healthy path, and only when they go off the trail that you actually need clinical interventions that will bring them back to the track. Right? So more patients being in control, more focus on preventative and proactive care is where we think we should be moving towards as an industry.
Very good. Well, I thank you again, Vijay, and Vijay, and we thank you to TeleVox once again for helping us bring this great educational content to our audience. Thank you, of course, to the audience for tuning in. As just another reminder, this will be available on demand shortly, and we'll send you out an email to let you know when you can access that on-demand copy. Thank you very much, everyone. This concludes today's webinar.
Thank you for having us. Take care.